Your hand up if you've ever had a fever. Yeah, fever. Please keep your hand up if you've ever had any one of the diseases on the screen. Thank you. So the diagnostics that we develop answer that question.
Okay.
The diseases that are indicated on the screen are called emerging and dangerous pathogens. These diseases are infectious. And it's important that when someone has one of these diseases, we identify, in some cases isolate, and manage the patient. Now, the challenge is that when someone has one of these diseases, they have common symptoms of fever, headache, and muscle aches. And currently, if someone is suspected of having one of these diseases, their blood is taken and sent to one of 14 labs on the continent. Now, if we look at the numbers, there are about 1 billion cases of fever, headache, and muscle aches every year. Now, when a patient walks in and they have these symptoms, you'd suspect, well, I think it's malaria. So you do the malaria diagnostic. And if you look at the numbers, about 212 million people have malaria. So we've got a floating 700 million patients. Now, the current means of diagnosing if someone has one of these diseases is expensive as well as suboptimal and doesn't result in adequate patient management. Now, what we are developing is a disease diagnostic and surveillance platform. It's a diagnostic where you put blood on the diagnostic, and within 5 minutes, you know what disease the patient has. But this is a digital diagnostic. It then sends a message to an online platform and tells us the location of the patient, which allows us to predict where the disease will spread. The first diagnostic we are developing is for Ebola diagnosis. And then after that, we are developing a diagnostic for the diseases that we saw on the screen. The reason why we are starting with Ebola is because of a study that was done, which indicated that the presence of an Ebola diagnostic in the 2014 Ebola outbreak would have reduced the size of the outbreak by 32%, which means 32% of the lives lost could have been saved. Now, there are diagnostics against the Ebola virus that have been developed. And so the question is, why are we doing what we are doing? Now, if we compare the diagnostic that we are developing with the diagnostics that are currently on the market, the challenge in the robustness of the diagnostic. The diagnostic that we are developing does not need to be kept in a fridge during transportation and storage. This significantly increases access to the diagnostic because it means that the 50%, more than 50% of the clinics on the continent that don't have access to continuous electricity are able to stockpile these diagnostics. The second issue is that the diagnostics don't expire after 2 years, as the ones that are currently on the market, which means that a community, a country, or an organization can stockpile these diagnostics for use. The last thing is around connectivity and the ability to use the diagnostic to predict what's going to happen and where the disease will go, and to build models with it. Now, one of the challenges that we face in the diagnostic space is around, if it's a diagnostic being made for Africa, the first question that someone will ask you is, who pays for it? And so we spent some time working around that business model innovation part, trying to figure out how do we pay, essentially in our case, the public money with the private money, so that we can come up with a solution that is sustainable. One of the challenges then becomes, if we are selling, say, our diagnostic to an organization, say a global health organization, or a country, it is such a large customer acquisition cost that a startup might not be able to shoulder that. And so to be able to do that, we've been identifying different private players that can come in and help us. And this is one of the things that I'll be interested to hear what your thoughts are, so that we can start to see what are the other things that we haven't thought about, that we can start organizations we can work with to be able to ensure sustainability of the work that we want to do. To be able to get to where we are now and to be able to go to where we want to get to has been through the support of our directors as well as advisors. To be able to build the company, we've built a board which consists of people with great scientific excellence, people that are knowledgeable in the diagnostic sector, as well as finance and supply chain on the African continent. It's at this moment that I'd like to thank Kevin March for his support, because Kevin is always available for us to poke holes into the business and continue to grow. Thank you so much.